Hi, my name is Travis Rummel. I'm a physical therapist, Healthworks Rehab and Fitness, and the clinic director of our Smithfield clinic, and I'm going to give you some instructions and some demonstrations on how to perform exercises for acute, right after an acute knee injury or after a knee arthroscopy. One of the first things we want to focus on after a knee injury is managing swelling and trying to restore range of motion. So one of the first exercises we'll do is a heel slide. And you're going to lay down. So lay on your bed and just kind of slide your heel on your sheet, kind of keeping it nice and comfortable. And again, so it's working on basically range of motion. You're trying to gain flexion. Start out doing 15 to 20 reps and then kind of work our way up from there. Here, go ahead and set up for me. Sometimes if we get pain around the kneecap with that, if things aren't tracking right, we can do our own Patella Mobilizations. So when the knee bends, the kneecap has to push down. And when the knee straightens out, it slides up. This is something we will work on during physical therapy, but also something that you can do on your own. And again, none of these exercises should be super painful, maybe a little stiff, maybe a little swollen, or excuse me, maybe a little sore, but no sharp pain. And go ahead and try a couple of those just to show them how to.
Yeah, just like a self-mob?
Yep.
Gotcha.
Self-mob. Good. All right. Sometimes with a swollen knee or a post-surgical knee, we'll have the knee won't want to straighten out. So there's a couple exercises we can kind of do to get that to happen. We can stretch out the muscles that attach behind the knee. We can grab a strap or a belt. We can do a calf stretch. So simply keeping the knee straight, pulling back on the ankles, and we're feeling that calf stretch. You know, we're going to hold for about 30 seconds or so. We can increase that hold time as we go, even up to a minute, and probably doing 4 to 5 reps of this. And again, we don't want a sharp pain with any of this. We want a comfortable stretch in the muscle underneath. Okay. Same position. So we're going to go to another muscle group that attaches behind the knee. We're going to go ahead and do a hamstring stretch. So we can kind of keep the shoulders back, take good care of our back. We don't want to bend at the back. We're bending from the hip and feel that hamstring engaged. Same hold time. 30 seconds. Giving it 4 or 5 times, and then we can increase our hold time as we go. Another thing we want to work on with an acute knee injury or after a knee arthroscopy is we want the quadriceps to fire. Whenever there's swelling in the knee, the quadriceps like to turn off. So simply doing a quad sec. That's tightening the muscle up here, and the heel pops up off the table. We're going to hold that for a few seconds. 1, 2, 3, 4, 5. Relax. And then we're just going to kind of go from there. Good. And we start out doing 15 to 20 reps and trying to do that. If the muscle doesn't want to fire, we can bring our good leg up, our non-injured leg, and do it with it, and you may get some neural carryover from that standpoint. The last exercise we're going to demonstrate is a straight leg raise. So if we want to progress this, we can kind of tighten that muscle up, lift up to about calf height, and down. So if the quad set gets easy, we can add a straight leg raise to it. And this we'll start with a couple sets of 10 and we'll progress repetitions from there. So again, those are just some easy exercises that we can do to get started whenever we freshly injured a knee, or it can even be started right after a surgery like a knee arthroscopy.